In the 1980s, dental caries was widespread in Jamaica. Every child had 6.7 decayed, missing, or filled teeth. Fewer than 3 in every 100 children were free of caries. Dental caries, also known as tooth decay, is the process with which results in a cavity. This occurs when bacteria in your mouth produces acid that eats away at your tooth and the tooth's enamel. When a person eats food containing simple sugars, the bacteria use the sugars for their own metabolic needs and produce acids as byproducts. Here are some pictures of children with caries. Poor oral health can add significantly to the disadvantages a child faces in terms of both personal health and life chances. Untreated caries is painful and may affect diet, school attendance, and sleep. Poor oral health can be lifelong and span many generations. Impaired eating habits and persistent oral infections can continue into adulthood and contribute to overall health. Dental treatment is expensive, and the cost of treating caries mount with the progression of the disease. In many developing countries, treatment is unavailable because of a shortage of dentists. It is in such settings where prevention can make the biggest difference. Since the mid-20th century, researchers have known that much dental caries can be prevented in countries and areas where fluoridated water, fluoridated toothpaste, or fluoridated salt has been made available. The prevalence of caries has fallen sharply, despite the fact that people continue to consume large amounts of sugar. In the early 1980s, Dr. Rosalie Warpia was intrigued and concerned with the mounting cases of caries, so she set out to find a way to introduce fluoridation into the everyday lives of Jamaicans. Warpia identified salt rather than water as the method in which the public should receive fluoride. Jamaica's circumstances were highly favorable for introducing fluoridated salt. All of the island's water supply naturally contains very low levels of fluoride. However, water fluoridation is only effective if the water supply system is regulated and the majority of inhabitants have access to the piped water system. In Jamaica, this is not the case. Equally important, the island has one sole salt producer, Alkali Limited, so the intervention could be achieved fairly simply should the company choose to go along with salt fluoridation. Warpia took her proposal to Alkali Limited, where she spoke with Trevor Milner, a chemical engineer, who was very interested in what she had to say. And so the process began. There were now many questions to be answered, such as which fluoride chemical should be used, at what levels, would the fluoride interact with other compounds in the salt? For answers, Milner and other chemical engineers traveled to Switzerland to learn more about salt fluoridation. After their trip to Switzerland, the company returned and installed the necessary equipment at the cost of about $3,000 to fluoridize the salt. After the completion of necessary legal and regulatory framework, a major advertising campaign informed Jamaicans of the fluoridation program, and in 1987, fluoridated salt went on sale. The salt contained 250 milligrams per kilogram of potassium fluoride, a concentration used for domestic salt in Switzerland and France. The Ministry of Health provided biological and chemical monitoring of the salt, while the company performed its own quality control tests daily. The Jamaican Bureau of Standards monitored the fluoride concentration of the salt. In 1995, Warpia and colleagues surveyed children's teeth. They found a dramatic improvement. The severity of caries had fallen by more than 80% in both 6 and 12-year-olds. The risks appeared to be minimal. Fewer than 1% of children examined showed any evidence of excess exposure to fluoride, and even in those cases, the problem was mild. Independent scientists confirmed the findings, and in a separate line of evidence, the island's dentists reported that the incidence of dental caries was rapidly diminishing. The cost of the chemicals is low, at about 1 cent per person per year. Taking into account the entire cost of the fluoridation program, including equipment, running costs, and monitoring, salt fluoridation in Jamaica costs around 6 cents per person annually. This is an even lower cost than the water fluoridation, which may cost up to 90 cents per person per year, depending on the size of the community. In treatment costs alone, the return on investment in salt fluoridation is substantial. It is estimated that for each $1 spent on salt fluoridation in Latin America and the Caribbean, about $250 will be saved in reducing the need for future dental treatment. Because the introduction of fluoridated salt in Jamaica was a national-level community intervention, it is impossible to be certain that the fluoridated salt alone achieved the reduction in dental caries. Communities elsewhere in the world without access to fluoridated water or salt have also seen some modest reduction in dental caries in recent decades, usually attributed to the introduction of fluoride-containing toothpastes. However, in the absence of data on the proportion of children using fluoride toothpastes, it is impossible to judge what part these toothpastes may have played in improving children's teeth during the decade. During the 1980s and early 1990s, children in Jamaica rarely had access to dental health education in school, and school dental services were very limited. Although a combination of factors may have been responsible for the improvement in children's teeth, salt fluoridation is the likeliest factor. The program has continued to be implemented successfully since 1995. Thanks in part to the passage of legislation to protect the fluoridation program. Fluoridated salt is now being exported from Jamaica to neighboring countries. Through its impact on the health and well-being of children from low-income households and the demonstration effect that influenced other countries in the region, the Jamaican Salt Fluoridation Program shows how much can be achieved with focused attention and creative problem solving. Let's recap. Dental caries is a chronic health problem suffered by children in Jamaica. Dental caries is the progressive loss of tooth mineral and the invasion of the demineralized tooth by bacteria. This bacteria creates acid, and the acid eats away at your teeth. Caries burdens Jamaica in several ways. Untreated caries can affect diet, school, attendance, sleep, as well as speech and language in children. Caries can make for a long life of poor oral health and span across many generations. This is where we can see how big of an impact this really does have on Jamaica. Women with or affected by caries increase their risk of having a premature birth or other adverse outcomes. One study found pregnant women with periodontal disease are 7 times more likely to deliver preterm or low birth weight. This affects Jamaica in several ways, in that it puts the mother at an increased risk of death during birth, but also affects the Jamaican population as a whole, because the birth rate decreases and the population does not grow. Salt fluoridation was determined to be the best intervention to combat dental caries. It is easily accessible by all, as well as easily monitored, as there is only one salt production company on the island. As with any intervention, continued success is key. Local public health leaders need to continue to keep legislation up to date on fluoridized salt. They also need to continue to educate the public, especially children, on dental health. Making fluoridated toothpaste more available to the public would also be helpful. Overall, this intervention is perfect for Jamaica. They looked at their resources and ruled water out as it is not accessible by all. Fluoridizing salt worked for them because it was good for their tight budget and it would be easy to achieve as they only have one salt production plant on the island. While this did work in Jamaica, I do not think it would work in other countries such as the US. This is a great example of how much can be achieved with focused attention and creative problem solving.